Good morning, Salibonani. Welcome to Asake Online. My name is Sikhangele Ngwenya, your host on the weekly affair. We are still catching up on current and COVID-related issues. Today, I want to explore and see whether there is information gap between the rural and urban areas. We have in studio a brother who is going to tell us more about his experiences working with rural communities. Welcome to the show.
Nyabonga Mangwenya. My name is Nkosikhona Dibiti, popularly known as Kalanga Boy. I work for an organization called Community Podium, where we focus on rural communities and also working with them in terms of promoting access to information and also trying to bridge the information gap that exists in those communities. And also the issue of misinformation, fake news, it's prevalent there because people have no means or ways to verify. Nyabo.
Thank you so much for that comprehensive introduction. So as someone who is working with rural communities, what would you say is the information gap? And looking at how COVID was ravaging the world, do you think it was more emphasized in urban areas than in rural areas?
I think for in our observation, working in the rural Matabeleland, we noticed people were relying on WhatsApp mostly for information. So in them relying for on WhatsApp for information, we then decided to say, okay, let's talk to the different communities and understand how they do it. So you find that in communities, lapana balama WhatsApp groups are. So they added us in those WhatsApp groups. You will see a lot of forwarded information, and largely, I must say, especially in Matabeleland and North, the disinformation mostly was coming from people who are in South Africa, who were getting information in South Africa that was not relevant to Zimbabwe, and then sharing it here. So you find that people, their trusted sources of information were those out of the country than even us who are in the country. They will say, so that validates it. And we don't know what Malumu sevenza on one, we taking information on. So those were the challenges that we faced. But also the gap that we also noticed is that abaning babe in relying with information on WhatsApp. Now usufaka information that is verified, like we partnered with the Ministry of Information in Mat North to share information about COVID-19. But you realize that people had their own sources of information. Why? Because the trusted sources is peer-to-peer. But anything else that is not maybe a news organization like ourselves, be like, ngobani bona laba, and things like that. But you get to areas like Binga. I will give you an example. In Binga, even up to now, they have the lowest numbers of people who got the COVID-19 vaccine. And we went there to ask, what is the issue? They said, Tininto Zama China science. Like it was like a chorus. You move from this community, and Sudu, the same thing. But I said, let's see in 3 years. So I don't know where that came from. But that also shows how our societal structures have their own trusted sources of information within this. So we can come and create content that will educate them. But within the community, they say, anything that is from this country and the other, we are not taking. So those are the issues that, so it shows you that there is a serious divide in terms of accessing information, and most importantly, accessing verified information to then say, okay, can people make decisions and are based on information? Because most people were making decisions like, okay, Zanato Iskhaqa, for example, was one of the issues. She has not had Iskhaqa has a problem. Why should we get vaccinated? She has not had in a problem. So each community, we noticed, each community has its own way of surviving using the simple plans that were in that particular community. So you find that while it's in the city, people will be talking about go and get your jab at this place and what. There is another different conversation. Let's go and Tati Zumbani tell us how uzaba right. But also most importantly, Emakaya, there was the issue of, especially in Kai, there was the issue of distance to the vaccination centers. So while you have information, but accessibility of the vaccination centers was also a problem. You get the first jab, uzukogezite, mina phela ngabuyela ngelanga 2 weeks zami sezikwanile. Kwafika kwathiwa kayikho yona le yesibili. So senza zembuyele nini futhi. Ngoba there is not that communication. The clinic has no way to put out information to say iseke jab bantu sibuyile. Selingabuya from this time and this time. There wasn't, and it's you going to check. Ma ungathola kungela akula. So that has been a serious problem, but I feel strongly that a lot needs to be done. There is a serious gap.
Okay, you said quite a lot of things around access to the centers. Was the vaccine available throughout the COVID as it was available in towns? And also, were people interested? Besides the distance factor, were people interested? Did they really understand what the vaccine was about from your perspective?
From our perspective, we feel strongly that kwakungela information ekwanile. You will find that I will use Binga as an example because we really spoke to those people at length. They will say, kuza announce ukuthi kule COVID-19 vaccination eyenzakala i-COVID vaccine iyenza lokhu la lokhu kukhulunywa ngesindebele. But those people will tell you ukuthi isindebele siyasizwa kodwa it's not our language that we can say ukuthi we have understood ukuthi when. So that was the outcry to say yes siyayizwa. Futhi sizwe kuthiwa ngeChina kumbe ngiyangaphi ngaphi. So that's all they knew. So outside ukuthi khona i-vaccine uvaccinate lapha because our vaccination centers were there. But people will still say I'm not sure ukuthi ngakwenza yini lokho kumbe ngizahle ngife kumbe ngithini nje abantwana bebodwa. That was the conversation. So it means there was serious information gaps. Ukuthi in that light we needed to have specific information tailor-made for specific communities using localized languages so that they understand. Now even kungabe i-radio program kumbe kuyini, still we needed to take cognizance of the issues exist in that community. Kuyafana ne-town, we have statistics every day, ama numbers abahlabile 20,000. Sibone ngani we are making progress, but that side it will be less and less every other time because people are like, if I do it, then what will happen? So you find that even as government also started doing mandatory vaccination, for example, for teachers. Teachers in those remote communities were the ones who were being vaccinated because of the job, not because they were, it was a decision, informed decision they made. So it was difficult even for the vaccinated to explain to the unvaccinated to say, if vaccine is local, and you find most information here we share, this vaccine is in English. People can't read and understand because that's a different language altogether. It's a health language and umuntu ukuthi ayizwisise kuba nzima.
Okay, that's critical. So you mentioned that there were people who had COVID, and mostly in Binga. And the government said that everyone should go on lockdown. So the nation was on lockdown. How did that affect rural communities? Is it really possible for rural communities to lock down, considering that they have to fetch firewood, water, and things like that? Is lockdown applicable in rural areas?
I don't think so. I will use our experience. We went during the lockdown, we went to Choloch. I was the only one in the supermarket who was wearing a mask. So like people will be looking, it was not. In the height of the pandemic, people were not wearing masks. It was normal. Life was normal there. There was no that strictness around, social distances like we're doing in Lapema town, which social distance or sanitize. Why? Because many didn't afford maybe to buy sanitizers and be sanitizing everyone. Like your business is in town. But what I noticed is that their own way of survival, that was not restrictions guided. I flew. We flew lokum fana ungayisabi flew nje azinatela nje uthi cup kuthiwa yini lokho okuyisihlahla lokho kuthiwa yini okuzumbani ngesindebele kuthiwa yini so babengela problem nomuntu, and everything was normal. So those restrictions limited mostly food supplies for them. because many of them relied on, you know, Omalayicha coming in to bring food. Some relied on diaspora. There was less of that. Less of travels, intercity travel. That was where the pain was. Which you can't go to town. Even if you can't go to town. Even if you can't go to town. Even if you imali umbuya uyithunyezele isihlobo ekhona. Yiyo lapho okwawulendaba enkulu ukuthi bantu sesiyakufaka endlala ngendaba ze lockdown lesi.
Okay, that's interesting to note. So in terms of the quarantine centers, did the government make any efforts in terms of having those facilities available in case people have COVID, or it was just no authority, no one talking about quarantining and things like that? What was the situation?
I'll give on quarantine centers. I'll give a case study of Elupane, Echocholo. There was a quarantine center there, but you find that people did not understand why one person had to be quarantined or taken from home a quarantine. So you find that that was the major issue, to say quarantine, what happens there and what should happen there. So that kind of information gap, because people were looking forward to being treated somewhat, and you come back okay. So you find that was the major problem, to say that was the major problem. But you find that in Chocholo, for example, there was staff members there who got COVID, like the health frontline workers who got COVID. So immediately that is the message that spread across the area, to say, so it's like you are going to a quarantine, kind of conversation. So it becomes difficult. I remember we speaking to the provincial health administrator, no, some of the staff members have closed this hospital, and because nurses tested positive for COVID. So umuntu la uma egula sibile funke esibhedlela uyayala ethi khona nyahle nyefela khona ngalantu labo nesi bebambi iCovid noma begqoka izinto zoleza babezigqokela ama-overalls abo lama. So that was the major problem. So you find that access to information, it can destroy a society and can develop a society, because I noticed we are not moving together. In as much as you can open a quarantine center, people will not go there because they don't understand why it's there, what needs to be done. If frontline workers tested positive for COVID, they are confused to say, if these ones abakwazi ukuthi kuyini COVID lani begqoka lama protective clothing beyitholile, kushuthi that is very ngcono sizihlalele khona la uyalanda kuyakufa. So those are the kind of conversations that quickly change. While in other countries where maybe in the diaspora, quarantine center, and someone is saying that as a goal. A different story altogether. So that information kind of access is very critical, especially COVID and even lockdown restrictions. That you find that maybe they had impact in the cities, I don't know. But for the rural community, it's just like one other thing. Oh, so good way. All right. So good way. 6 and the enforcement was not there.
That's a critical point there. So you mentioned that there were people with COVID in rural areas. Would you relate to that, to the migration from South Africa to probably rural areas, considering they were able to penetrate? So would you relate that to migration, or it was just COVID within the local transmissions?
From the statistics from Ministry of Health, we noticed that it was more of transmission, especially December 2020. Because remember, December 2020, the borders were partly opened and people came in and everything. Then immediately after that, it was total lockdown again. So that was where we had a lot of reports from the Ministry of Health showing that it was returnees, mostly returnees, transmitting to the locals that were there. But within it was very limited numbers. But when that gap came where in December 2020, where people were coming in from outside Zimbabwe and everything, that's where the numbers actually escalated more. So which means there was a lot of transmission from, you know, people who are coming from other countries and coming to visit their families. So in the process of visit, abantu basale sebelo bhubhane lwe-COVID-19.
Okay, so 2 years later, we're on the third year now, still COVID with us. What would you say are some of the strides that the government did for rural communities in terms of improving preparedness and stuff like that? And you, as an organization, what are some of the strategies or measures that are in place in case COVID comes in a strong wave again?
I think for rural communities, what government did was to try to actually government in partnership with other development partners, because I remember in some communities in Nkai you would see village health workers like omama kwampana kudojwe elayinini kudojwe 2 bebe bezotrainwa as village health workers to go back and talk to people about COVID-19. So those are some of the strategies that I feel worked, because I remember as Mnyama we spoke to one village health worker ePlumtree, why explain ukuthi hayi abantu babuya kimi sibili sebebuya endlini yakho ukuzobuza ukuthi lapha kuhamba njani, so ngithini umuntu ama symptoms abantu basebewazi ukuthi nxa usuchisa usuthini high temperature lani yikho ababe focusa on village health worker la yafika recommend according to what they were taught. So those were the foot soldiers, health foot soldiers who could easily be accessed by ama communities ukuthi nxa ungana usezwa kuhle umbe suchisa umbe sunjani hamba kunabani explain nayo abahamba ku training, where government was in partnering with different development partners to at least have people who are always in the communities to share that information. But also issues of hygiene were really critical, in as much as we're saying mask up, wash your hands regularly. It was at times not possible for some communities. Wash your hands isikolo sethu asilamanzi. So sesithi abantwana omunye lo mntwana akabuyele 2 liters ithula engene befike bethele Dramini ingene esikole ufike uthele Dramini, so nxa usufuna ukuya toilet usuthi geza seligeza khona lapho. So that was another strategy that, you know, even schools were trying to use to just ensure that there is hygiene. So for us as an organization, our main drive was to try to make sure that imbali yonke le ade ngikhuluma ngayo ukuthi kwakunjani ngaphi, we're trying to then say how do we package information that can be understood by people, because kwesinye isikhathi ungathi wash your hands umuntu ayothi ndoda amanzi ngaba ayahlupha, which means your intervention is useless already because akulamanzi. So we're saying ukuthi accessing credible information was very key. And how do we do it? We said, okay, we'll recruit community reporters khona lapha imali ihlala khona. We are not saying we want journalists. We want people who are excited about telling the community stories. What we recruit, we train them, say, okay guys, learn now one information I see on WhatsApp groups and just share correct information. Just explain to people. Why? Because we feel strongly that development, the distraction in society is about information. If we're saying let's go left and people go right, it can be a problem. In the midst of a pandemic, and things like that. But we needed to have a community that can be resilient in case it becomes a disaster. In case people are swiped out and they die, how are we going to respond to that? So those were the things that we're trying to keep tabs, and also with health officials that can comment on those issues to explain and explain around vaccination centers. Like I said, we partnered with Ministry of Information, Emat North, to help them share information. They were going around with hailers explaining Bantwagit is so in the height of the pandemic. But I feel strongly that even going forward, while this COVID-19 is still there, we need to try to simplify. The jargon was too much. Even me, when you are am I about to go and vaccinate, and do I really know what's going on? You are supposed to allow us, is this for real? Let's simplify the information. Let's localize the intervention. Let's not have a one-size-fits-all approach. So let's have approaches that are relevant to the communities. It can be language barriers. It can be even barriers of saying our interventions are temporary. while and leave the communities the same way we found them. But what we are saying is let's have homegrown, grassroots-based approaches to these kind of interventions, so that even singathi eCholotsho kujakuba lama floods, even singathi sokuzaba le flood eCholotsho, that was one of the cases as well. Ukuthi abantu don't know what to do. There is a what wind coming and is going to pass through. They don't know, and we know for 2 times Cholotsho has had floods, and those people have not been given decent homes. And it's many. So those are intervention disasters that can happen. But how then can we help communities with be affected or people dying or losing lives because of these disasters are occurring?
That was not provoking. So my next question to you is, there are reports that other countries are stripping down COVID restrictions. What do you think will happen to the communities that you are working with? Do you think that's a good idea? It's a way of us going back to the normal. Are we really going back to the normal? What does it mean for you?
For the communities largely, abantu bakutsho ungabona isikole sesivuliwe sokunormal to them. If schools open, everything is now normal. But also, I feel strongly that I've seen information centers that government has put up in different places. If those would be of use, they could help. Ngoba kulama structures, CVD, I saw one in Cholotsho, kulama structures that would help. But right now, the conversation about COVID-19 is actually dying. So when you invited me to this program, I was like, oh, we're talking about COVID-19 because it's largely gone. People are now busy about other things. It's in Zimbabwe in context, maybe I want to say elections and this and that and that and that. But the conversation about COVID should continue because people are being gathered more this time around in rallies, in what, and everything is open. Churches are working and everything. So we need to have that kind of conversation to say, if we are relaxing, does it mean that there is no COVID-19 anymore? What information should we give people? Because if we relax and say nothing, people will assume it's off. And then the next time, maybe we have another wave, or it will be the 4th wave. They'll be like, hey, it's back again. So we don't need to have these conversations dying and rising up again, dying and rising up again, because it confuses the masses. If it's relaxed, people should be told, while it's on relaxed mode, this is what you should adhere to. This is what you adhere to, even in rallies. In terms of vaccination card. So those conversations should be there if there is need for us to get to understand. Because I'm thinking, Mangwenya, if kungaba lenye waves qala phansi sesakhohlwa sonke ukuthi kanje kwakuthwani kanje sasinathani ijinja ke in and it becomes a problem.
All right, thank you so much, Dibiti, for the insightful conversation. We are all challenged, especially to localize our information. Everyone should be part of the table in terms of distributing critical information, especially to the rural areas. If you have anything to say as we close up the show, you can just share with us.
Okay, I think for the marginalized or rural areas, I feel strongly that we should be more prepared should we have another wave coming up in terms of quarantine centers, in terms of explaining to people, in terms of approaches that we can use with abantu bengathathwa yi-COVID-19. And most importantly, in my parting shot is, let's have these conversations going. Let's not allow them, me included and everyone who's watching, let's not allow the conversations to die and then go back to a normal mode, such that when there's that kind of COVID-19 caught us off guard, but we can't allow it to catch us off guard again. So we need to be continuously ready to say, okay, how do we intervene? In case, from the things that we have learned in the past 2 years, we should be able to say, if there's any 3rd wave, 4th wave, whatsoever, we should be able to say, things will go not as bad as they were in the first wave. Yeah.
Thank you so much, Nkosi, for joining the show today. Siyabonga kakhulu for your coming. Thank you for watching the show. Do follow us on all our social media platforms at SiteZW. Till we meet, it's goodbye for now.